for attending this Division of DD Health Home webinar. This is basically an introduction to DD Health Home for you. And as Kat said, this is being recorded, so we will be posting this. We do ask that you go ahead and put questions in the chat, and then we will get to those when we finish. My name is Leslie Bradley, and I work for Division of Developmental Disabilities, Department of Mental Health, and I am with the Federal Programs Unit. I'm going to let Kim Stock introduce herself as well.
Thank you, Leslie. Good evening, everyone. My name is Kim Stock, and I am with the Division of Developmental Disabilities with the Quality Programs Unit.
So basically what we're presenting tonight is a proposed vision for the DD Health Home. And the Division of DD is working with Missouri Department of Social Services, Mo Health Net Division, or Medicaid, to implement this DD Health Home, which will help coordinate care for individuals served through the division who have a qualifying health risk and chronic health conditions. Before the DD Health Home can begin, it has to be approved first by Centers for Medicare and Medicaid Services, or CMS, through what we call a state plan amendment, or SPA. SPA is a CMS requirement that helps the division plan, implement, monitor, and conduct quality services through the DD Health Home. So let's begin by talking about what a health home is and what it can do for eligible individuals. A health home can support individuals in managing chronic health conditions, medications, and medical treatments. It can assist individuals with meeting their healthcare goals and provide information about general wellness, healthy eating, or exercise. The health home team will partner with an individual's planning team to identify and address specific healthcare needs. And while it is important to understand what a health home is, it's equally important to understand what a health home is not. A DD Health Home is not a home. It is not a place where you go to live, and it will not change where you live. It is not direct medical services. It's not like your doctor's office or a hospital where you go for treatment. It does not change an individual's planning team. It actually will add another partner if the individual so chooses. And if the individual makes the choice to participate in the DD Health Home, it will not affect an individual's current Mo Health Net or Medicaid benefits or services. The DD Health Home is an additional service option for individuals who are Medicaid eligible and served through the division. This includes individuals in waivers as well as individuals not in waiver services. This is for individuals with identified health risk and chronic health conditions. Individuals can choose to participate in this service. It is voluntary. And if they qualify, and we'll get to those qualifications in the next slide, then individuals participate in this program. Individuals in the Health Home program will have access to a team of qualified healthcare professionals that promote wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home team will also support an individual's existing planning team. Individuals will be supported to identify their overall health outcomes, health risk, learn how to address their health risk, improve the management of their chronic health condition, and therefore improve their overall health and wellness. Keep in mind, all of this support will be driven by the individual and their identified healthcare goals. And providers of the DD Health Home will be DD targeted case management entities and DD accredited or certified HCBS or home and community service waiver providers.
So this slide speaks to the eligibility criteria to be enrolled into the Missouri DD Health Home. And again, the intent is to serve adults and youth with a developmental disability eligible for Division of DD services. And they must have a health risk screening tool completed and have a healthcare level of 3 or greater and have one or more of the below chronic health conditions, which include diabetes, asthma, cardiovascular disease or hypertension, chronic obstructive pulmonary disease, COPD, overweight with a body mass index or BMI of greater than 25, dementia, dependent on a ventilator, or one or more of the following conditions that would place the individual at risk of developing another chronic condition, such as pulmonary aspiration, bowel obstruction, gastroesophageal reflux disease or GERD, seizures, sepsis, dehydration, tobacco use. Also, an eligibility criteria would be the diagnosis of someone that is diagnosed on the autism spectrum disorder.
Will be auto-enrolled in the DD Health Home program. And what auto-enrollment means is that when the DD Health Home is approved by CMS, individuals eligible for the DD Health Home program will receive a letter notifying them of their provider's name and that they will be receiving a care provider. Individuals can request to change DD Health Home providers or stop receiving DD Health Home services altogether. There is no charge to individuals for this program, and participation is not required. The individual's choice to participate. Participation in the DD Health Home program, again, will not affect an individual's current MoHealthNet or Medicaid benefits or services. Regarding provider infrastructure, the DD Health Home providers will be enrolled statewide, and the division will auto-assign individuals to those providers within the division's 5 regions, which are Central Missouri, Kansas City, Poplar Bluff, St. Louis, and Springfield areas. So that means if an individual is receiving waiver services or support coordination services from a provider who also decides to become a DD Health Home provider, then they would be auto-enrolled with that same provider. There are 6 statutorily required health home services, which include those listed here on this slide, and we'll give you a brief description of each of those. Comprehensive care initial and ongoing assessment of an individual's healthcare needs and supporting an individual with development of healthcare goals to promote wellness and management of chronic health conditions. Care coordination will assist individuals with implementing and meeting their healthcare goals, monitoring progress towards these goals, and coordinating care with multiple providers, which could include primary care, acute care, behavioral health, and long-term services and supports. Health promotion is education and engagement of an individual in making decisions that promote healthy lifestyles and improve their overall quality of life. Comprehensive transitional care from inpatient to other settings is supporting the individual and their family or caregivers when the individual is transitioning between settings such as a hospital, nursing home, rehab facility, or back to their own home. This service could also be provided when an individual chooses to transition to a new health home provider. Individual and family support is coordination and information, as well as services to support individuals and their family caregivers to maintain and promote a healthy life with a focus on community living. And referral to community and social support services is providing information and referral to individuals and their family caregivers on community resources, regardless of the funding source, that can assist the individual with meeting their healthcare goals. Missouri will pay DD Health Home providers the cost of staff primarily responsible for delivery of services not covered by other reimbursement. This would include the health home director, physician consultant or nurse practitioner, nurse care manager, specialized healthcare consultant, and the DD Health Home facilitator, whose duties are not otherwise reimbursable by MoHealthNet or Medicaid. The DD Health Home PMPM includes health home specific training, technical assistance, administration, and data analytics. And PMPM stands for per member per month rate. All DD Health Home providers will receive the same PMPM rate, and this rate has not yet been developed. As we just mentioned, the DD Health Home team provides individuals with a team of qualified healthcare professionals that promotes wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home team will include a health home director, nurse care manager, physician consultant or nurse practitioner, specialized healthcare consultant, and DD Health Home facilitator. The specialized healthcare consultant will include one or more of the following: behavioral health consultant, dietitian, occupational therapist, physical therapist, or speech language pathologist. And let's talk about what each of those team members would do. The health home director is responsible for championing the health home program and integrating physical and behavioral health, prevention and wellness, managing health home enrollments, discharges, and transfers, as well as overseeing the daily operations of the health home. Consultant or nurse practitioner. Now, think of these very different than a primary care doctor or nurse practitioner that you would see for treatment or an annual physical. These positions stay very high level, very general, and establish organizational priorities for the DD Health Home for disease management and improving health status. They participate in case consultation with interdisciplinary teams, help educate clinical and direct care staff on the nature, course, and treatment of chronic diseases, and develop collaborative relationships and coordination between the DD Health Home organization and an individual's treating primary care physician, or maybe between the primary care physician and the individual's psychiatrist, or even between the organization and other healthcare professionals and facilities. The nurse care manager is responsible for overseeing the health trends of the entire population of individuals in the DD Health Home. They follow up on identified trends, participate in health education activities, including topics such as smoking cessation, disease prevention, and medication adherence, and complete medication reconciliations for individuals once they are discharged from the hospital. Specialized healthcare consultant focuses on managing a population of individuals versus specialty care. They support the care team and the individual in identifying and behaviorally intervening to improve and manage the individual's physical health condition, assist with medication adherence, treatment plan adherence, self-management support, as well as goal setting, and they facilitate staff trainings for the DD Health Home. Also allows the DD Health Home to have flexibility in offering additional consultation from a variety of healthcare professionals for special populations. So depending upon the needs of the individuals supported in the DD Health Home program will drive which specialized healthcare consultants will be needed for that health home. And the DD Health Home facilitator will have a close understanding of the community they serve and serve as a liaison or intermediary between health social services and the community to facilitate access to services and improve the quality and competence of service delivery. The DD Health Home facilitator tracks and facilitates individual enrollments, transfers and discharges, schedules meetings and appointments, facilitates information exchange between primary care and other specialists, tracks individuals' hospitalizations, discharges, and ER visits, tracks and facilitates health screening completions, and supports information technology functions, as well as supporting the DD Health Home General Team operations. So I know that was a lot of information, and to quickly recap, the DD Health Home is not a physical home. It's not a place where you live. It's a program that helps coordinate services and connects individuals to resources for their healthcare needs and goals, which helps them live healthier lives. And participation in this program is not required. The proposed implementation date included in the state plan amendment is January 1st, 2024, with many development and implementation steps between now and the date that you see. If you would like more information on the DD Health Home, or you're interested in receiving coordination services through the DD Health Home once the program is approved and implemented, or even if you're interested in becoming a DD Health Home provider, we would ask that you please email the division at ddhealthhome@dmh.mo.gov, or you can also visit the DD Health Home webpage with the site and the link listed here. So at this time, Oh, thank you, Kat. Kat dropped in both into the chat. So at this time, we're going to take your questions, and your questions and feedback are always very welcome and appreciated because this really helps the team as we are developing, planning, and implementing the DD Health Home. So please feel free to ask questions. Kat also has the raise your hand option. So if you don't want to put your question in the chat, if you want to come off mute, you can ask that as well. And these will be, like Kat said, these will be included in a FAQ document that we are working on and that we will be posting on the DD Health Home webpage. So Kat, it looks like we do have one question. So does the individual go to the health home, or is this a program that comes to their home to provide services? So that's a great question. So this is actually a program, and we are still in talks about exactly what this will look like, but the individual would be going to the health home program. There might also be some telehealth visits between the health home and the individual, such as face-to-face, over the, I can't even think of what those programs, what those apps are called now on your phone. So it might be a hybrid of both.
I'm not seeing any more at this moment.
Okay, I know that was a lot of information, a lot to take in. And again, this was only an introduction to it. And if you think of something after you think about this, you can always email us. We'll give it just a couple more minutes, Kat, in case somebody thinks of something they do want to ask or they want to raise their hand.
We have one that came in. Did you say existing waivered services providers will be where the health home services are housed?
So let me go back to that slide. And the providers for DD Health Home could be DD targeted case management entities that provide support coordination for individuals served through the division, or it could be DD home and community-based waiver service providers. So they will be providers of the program. Hope that helps answer the question.
We have one. As a provider, would we have to be linked to this through service coordination?
So it's possible that a support coordinator could refer an individual to the DD Health Home, but when we implement this program, individuals will be auto-enrolled based on the DD Health Home eligibility requirements that Kim spoke to on this slide that I have up. So it looks like we have another question in the chat. How will everyone's health conditions be monitored on a consistent basis or as needed? Kim, do you want to take this one?
Yes, the DD Health Home model, it's an individualized case-by-case consultation. And so it would be based, the frequency would be based upon the individual's identified needs in relation to the frequency of the health home supports. There is requirements, Leslie, I don't know if you want to speak to that a little bit in relation to kind of those core touches or requirements for the health home service itself.
Kim, are you speaking specifically about the health home services?
Yes, yep. That slide there.
Yeah. So as we talked about earlier, there are the 6 health home services that the health home team can provide to the individual based, like Kim said, based upon their needs as well as their identified health care goals. So that will also drive how often their health conditions are monitored and tracked and followed depending on what their needs and support needs are. So another question that just came in, do the DD Health Home providers go through an application process to initiate the services? So yes, if an agency is interested in becoming a DD Health Home provider, we are developing an initial provider application process to become designated as a DD Health Home provider. And there will be requirements and qualifications tied to that application process as well as contracting with the division. Again, like we said, if you are interested in becoming a provider, please reach out to us through the DD Health Home mailbox, and we'd be happy to answer questions. So just to give you an idea while we're waiting to see if anyone has any more questions, like Kim said, there are services that are provided by the health home team. And just to give you an example of what one would be a nurse care manager. After an individual is hospitalized, then that nurse would follow up with the individual, complete a medication reconciliation for the individual, and then find out if the individual has any follow-up care needs after being hospitalized, and just make sure that their needs and their goals are being met after that discharge. So that's an example of one of the activities and services that a nurse care manager would complete. So the next question is, do you have a way to provide the telehealth visits and educational training remotely? So I think that is something that we as a team and a division are still developing and talking about. So there will be more developments with that, as well as the educational training component with the individuals. But yes, that is something that we have discussed and will be continuing to work through.
So will clients be auto-enrolled or we have to apply? I think I misunderstood the answer to my other question.
So yes, individuals who qualify, who have the eligibility, meet the eligibility requirements, will be auto-enrolled in the DD Health Home program, and they will receive a letter stating that they have been enrolled and who their provider is, and that they will be contacted by that provider. And again, they will have the option to opt out. They will have the option to change health home providers. But yes, they will be auto-enrolled, and the division will be auto-enrolling the individuals. These are really great questions and feedback, and we do appreciate everyone coming tonight. We know that it's a really busy time. Evenings are hard, so we really appreciate you taking the time and learning a little bit about DD Health Home. Again, if you have any questions, please email us. Kat, if you're not seeing anything in the chat, I think we will go ahead and end the webinar.
Not seeing any more.
Great. Well, thank you, everyone. Appreciate it. Take care.